Still to come here on Eyewitness News at 4.
We may not know if winter will last, but the data is in about flu season and what doctors are saying about RSV and COVID. I'm Denise Sador. The very latest coming up on Eyewitness News.
4 weeks into the new year, influenza season is hitting hard at the Southland, and flu is not the only virus making a strong showing, with symptoms like fever, chills, and cough.
Circle of Health reporter Denise Sador spoke to a local emergency medicine physician about the effect of respiratory illnesses on ERs and hospital admissions.
You don't need a groundhog to tell you winter illnesses will likely stick around.
Kind of going gangbusters over the past probably 2 weeks.
Dr. Jeffery Davies, Emergency Department Medical Director at St. John's Hospital, says as a result of a huge influx of the flu, many local ERs are operating at maximum capacity.
It is, frankly, blowing up right now. It's really picked up.
LA County Respiratory Disease Surveillance ending January 25th shows nearly 29% more specimens testing positive for flu, 8% positive for RSV, and 3% positive for COVID, which doctors are starting to see much more of.
I was surprised to see it pop up, pretty significantly, I'd say, over this past month.
So far in LA County, 109 people have died from the flu and 141 from COVID, according to death certificate data. The elderly, the compromised, and the very young are getting hit the hardest, but severe cases can be found in all age groups.
I don't think it's ever too late to get a flu shot.
With flu activity very high in states like Florida, Wisconsin, and Texas, possibly heading west, Dr. Davies says flu season could last until mid-March. Besides staying home when you're sick, good practices are masking in crowded situations and hand washing. He says flu and COVID vaccine boosters could be helpful for some.
Your immune system can wane, and we know that's true in high-risk groups. So I think, yes, you have to talk with your doctor, and you probably got to talk with, if you're, if you have underlying lung disease, that's probably one of the highest risk groups.
And don't wait until you're really sick to see your doctor. If you're in early enough and you're eligible, you could get Paxlovid to shorten the duration of COVID or Tamiflu to shorten your flu symptoms. Denise Sador, ABC 7 Eyewitness News.